Welcome to Nurses Uncorked, where we pop the cork on everything in healthcare.
I'm your host, Nurse Jessica Seitz.
And I'm Nurse Erica.
On Nurses Uncorked, you get real, unfiltered facts and plenty of laughs.
Please follow us wherever you listen to podcasts, and don't forget to rate, review, and download.
Become a member of our winery, where you get early access to the podcast, bonus episodes, ad-free content, and much more.
Now sit back, relax, and pour yourself a glass
as we uncork the truth in nursing. Erica, do you have a yummy cocktail of the week for us?
I do. Summer is coming, and so I just went and stocked up on all sorts of exciting ingredients. Stay tuned for all the really complex cocktails that are to come. But in honor of summer coming, because it is hot here in Vegas, we are going to do a good old high noon, because you cannot go wrong. Let me open it.
And it's just past noon where you are. So
That's
perfect.
True. It is. It's 1 o'clock. This one is a vodka seltzer pineapple. So
I don't think I've ever had one of those, to be honest with you.
Really?
Nope. Tell me how it tastes. Is it refreshing?
It's really good. Yeah. I love these. Of course I love pineapple, but
well, cheers, Erica.
Cheers.
Let's get into this week's podcast. You ready?
Into it.
Hello, everyone. Welcome back to Nurses Uncorked. It's Nurse Jessica Seitz again with Nurse Erica. And we've got an episode today that is going to focus on if you are a nurse, you work in healthcare, and you have been traumatized, you have dealt with burnout, which I'm sure just about everybody has, unless it's maybe your first day on the job. I think it's something that it resonates with all of us. This is going to be the episode for you to really listen and pay close attention to, because it's going to be very, very informative. We have a guest with us today. I want to first say hello before we tell you a little bit about Dr. Lorre Laws. Welcome, Lorre.
Welcome.
Thank you so much for having me. This is just such an honor, and I'm such huge fans of everything that you ladies are doing. So thank you for all you do, and it's a pleasure to collaborate here today with you.
We're glad to have you on. Yeah. So let's talk a little bit about Dr. Laws, and then Erica's going to tell you about something generous that Dr. Laws is going to be giving away to somebody. So you guys are going to want to listen to this. So Dr. Lorre Laws PhD RN is a healer, teacher, and nursing leader whose clinical practice centers on nurse trauma, burnout, integrative health, evidence-based practice, and healthcare quality and safety. She facilitates trauma healing for students, nurses, and health professionals. Dr. Laws founded the Halen or Healers Heart Academy and Community, a nonprofit organization where nurses can come together in a safe and very nurturing virtual space to share and be supported in their healing journeys together. She has published numerous scholarly articles and has presented her work to national and international nursing and health professional organizations. Dr. Laws is attuned to her healer's heart and its calling to be of service to the global nursing community. In fact, the title of her book is...
Got it right here, my copy.
Oh, thank you.
Let me get that closer.
Yeah.
Nursing Our Healer's Heart, a recovery guide for nurse trauma and burnout, which we all are familiar with, right? So this is going to be a great episode.
Yeah. And as Jessica alluded to, Dr. Lorre, which you've given us permission to refer to you as Dr. Lorre, is generously going to give away a scholarship to one of our listeners to the Healer's Heart Halen Academy. Is it a 12-week program, I believe?
We have a 12-week program.
Yeah. And it's transferable. So if you yourself win and you feel like someone else that you know might benefit more, you can transfer it to that person. So to enter this, you want to pay attention for the keyword, which we will say later in the podcast, and then email us with the keyword at nursesuncorked@nursesuncorked.com. And the 10th email entry that we receive will be the winner.
Are we ready to dive in?
We're ready. Let's do it.
Oh, we got so much to talk about, don't we?
We do.
Yes, I can't. I'm seriously. I'm excited. I want to hear about. I think I need some healing right about.
I know I do.
Right about now. Maybe Dr. Lorre can heal me by the end of the episode. I don't know. We'll see.
Let's do it. We'll get a good start for sure.
Yeah. What inspired you to focus on nurse trauma and burnout in your work? What guided you to do that?
Well, I got my start as a CNA back in 1978. And worked my way through high school and college, and saw as a young woman what was going on, and got a severe back injury and was not able to enter the profession at that time. And but I spent 6 years at the bedside, and that really, when you're 15 and you're helping people pass away, it really forms you as a young woman. And so life happened, and I ended up entering the profession at 50, the same day I got my ARP, my AARP invitation.
Oh my God!
I know. I was like, do I go to the master's entry or do I go into retirement? It was like, well, I'm nowhere near ready retirement. And so I entered the profession then, because it had been haunting me, and finished the program, was ready to enter into practice. And through that, when you go through a nursing program at 50, it's very different than 20, right? I've been a business executive. I've raised 3 children. Like I am an established professional. I'm like, this is not any better than it was in the late 70s and early 80s when I was a CNA. The only thing that was different is we didn't have to wear all white, and patients can't smoke in their rooms.
Thank God.
Oh, we have an EHR. That got me really curious. And as I started doing my research, because part of my day job as a university professor, I do research and publish, and that's just part of my job description. And I was really looking at this burnout phenomenon, because why hadn't it changed in 50 years since I first, tried to enter the profession, couldn't due to, there wasn't a Hoyer lift for a 400-pound patient. So I went down, and my back is still wrecked to this day. And so I was looking at this going, why hasn't this changed? In 50 years, we haven't figured this out. And that started some big research questions that were complemented, quite frankly, by some of the work you and the other nurse influencers were doing so bravely, so boldly, advocating, shining this huge spotlight on what is really happening. Mm-hmm. And I was like, I need to be a part of this. But, my skill set is different. And so I like, what can I do? What can I do to make a difference? I'm at the kind of the end of my this is my 3rd career. I'm getting close to retirement age. How can I give back to this profession? How can I make a difference? And so I started asking some big research questions. And what I found was shocking.
In your book, and again, it's Nursing Our Healer's Heart, and we will link that, of course, in the episode description. But in your book, you eloquently describe nursing as a, quote, poorly crafted game of whack-a-mole with nurses, I know, I love that, with nurses running from one patient to the next, chronically understaffed, under-resourced, overworked, frequently marginalized, and disenfranchised by a poorly designed system that requires you to suck it up instead of prioritizing your safety and professional well-being. And boy, is that true. I'm wondering, do you have a specific story from your journey that led you kind of to create the nonprofit Nurse Trauma Healing Academy?
Well, it was actually born out of that, because when my own daughter went through her nurse's training, I'm like, are you sure?
Yeah.
Let me just check. Yeah. Okay. And I found that now I am her mother. She's living at home at the time. I'm conducting the research. I'm writing the book, right? Like, this is a family project at this point, because I can't shut up about it. And I watched this beautiful, as is the case for so many, not just my daughter, but all the students that I have educated over the decades. It's just like, it's almost like we feel like we're pushing them off of a cliff. We do our very best to prepare them. And then the system, like, steamrolls their healer's heart. They're so eager and earnest and willing to really make a difference in the way that not everyone, it's not a calling for everyone. It's a great profession if it's not a calling. For some, it is a calling, but we all have a healer's heart, or we wouldn't have even chosen it for whatever reason.
True.
And so I watched, in addition to my new graduates, I teach in a BSN program, integrative focused BSN program, and then watching my own daughter and her cohort, who were in my living room from time to time studying and preparing and all of the nursing school things, right? And I watched from getting their NCLEX and going into practice, and in under 4 months, my daughter and the students in her cohort, who I had become to know in a very personal manner, were all experiencing signs of burnout. And I'm like, this is not burnout. Like, this is nurse-specific traumatization, and much of it is avoidable. And so it's like there's this huge chasm out there that a lot of places provide resources. They're like, oh, here's a website, the ANA, all of the state nurses associations, and they're, and so there's all these resources. It's like, here, nurses, let me just push all of these resources at you, and y'all go fix yourself because you're not resilient enough and you don't know how to do self-care. And I was like, oh, heck no.
I like that. I like that.
And so I was like, we need a safe place where nurses, no matter where they work, no matter in which country they live, that they can come into a virtual space, which is not their employer's workplace usually. People don't feel safe to be vulnerable at work for all the obvious reasons. So it's like, all right, because I thought I was writing the book and calling it a day. I thought it was done. I did not see any of what was coming next. And so then it was like, yes, but healing needs to be facilitated. I've been a healing arts practitioner for over 40 years. And so this was my big dismay coming back at the age of 50, was like, there's no resources, there's no support, it's gotten worse, and now we're gaslighting the nurses. What can I do? And so the nonprofit was born, the academy was developed, and here we are. Nurses now have a safe place where they can go and really be facilitated in their healing, and not just like, oh, here's a bucket of like chemo and adjuvants, go figure it out, nurses. It's like, no, here, we got you. We can really facilitate the healing. So,
well, in all honesty, I think unless somebody's nurses are tired, so unless you're kind of guided and given some fuel to do that, the last thing that a nurse feels like doing is just going and reading something and having no give back, no anything. I mean, that's a really hard thing to get somebody to do because they're exhausted and they're tired of it. My next question was going to be, what was an early mistake or challenge you encountered when first addressing nurse trauma? And what did you learn from that?
This is a great question. And this is kind of a big professional leap for me to go from, researcher and, kind of this academic into this, really sort of a nonprofit entrepreneurial leadership type of role in these ways. And also learning how to develop and deliver a curriculum that is nurturing. We're also traumatized from nursing school. I have never maybe you guys have, tell me if you have, but I have never encountered a nurse that's like, I had the best nursing school experience. It was ease and it was grace, and I felt so supported, and my transition to practice was so lovely.
Never.
And so, said no nurse ever, at least in the thousands that I've talked to. And so what I learned was that with trauma, and so most nurses are being told an outdated narrative, let's call it purple Kool-Aid, that says, it's burnout because the World Health Organization says that that's occupational stress that isn't being effectively managed.
Mm-hmm.
And so when I started really looking at that and like, how can I build a program that really meets the nurses where and how they are, because it's not burnout, it's nurse-specific traumatization in most cases. And so what I learned was that you can't go when it's trauma healing, you can't go too fast, because it's an unwinding of the nervous system. So too much, too fast, too soon, which is kind of how I'm trained as an educator, right? In a BSN program, we have essentials, we have all the NCLEX parameters. And so we have to, it's a fairly regimented way of teaching. By contrast, this is sort of the antithesis of that, where it's like low and slow truly is the way to go, because we need to unwind that nervous system, and nurses learn the language of how to navigate it and how to start, using neuroplasticity to retrain the limbic system and the nervous system. And so what we can't do is exactly what we do to nurses, nursing school and new grads, is we can't just shove a whole bunch of information and bowl them over. And so that's why you pilot test, right? That's why you don't roll out a program until you've sorted these things out, like what is the best approach that I can take. And so, yeah, but if early, I learned that, I saw that quickly. I was like, oh, I need to like rethink this, how we go about this, because there's a tiny education piece in there, because what we're not getting in nursing school and even in our, continuing education is that we're not getting the information we need about how our mitochondria are being affected, polyvagal theory, cell danger response theory, of how we can really, navigate the challenges and the traumas that we're experiencing. So
my mitochondria was very affected. I can tell you.
All of us, right? Yeah. I mean, all of us.
Yeah. I think my mitochondria fried about 10 years in.
Yeah. And that leads to a whole bunch of chronic disease, chronic conditions, conditions. Yeah.
I love the term nurse specific traumatization. And you're right. It's not burnout per se. I always say, it's not that we're burnout, it's that we're exploited. Let's call it what it is. How does your approach to nurse trauma differ from traditional methods? Can you kind of walk us through how you assess a nurse who might be experiencing trauma or burnout?
Well, the first thing you have to tease out, or I think the first thing really to even understand, is that I did this whole big symptom cluster analysis, which is like some geeky researchy thing, right? And so when you start looking at all the symptoms of burnout, compassion fatigue, and nurse-specific traumatization, which is really a term coined by Dr. Karen Foley's works. I just want to give her attribution, who she came out with the middle range theory. So now we have framework to go to our nurse leaders with, which is so very helpful. We have evidence that we can go to. And so the first thing is to really understand that the Kool-Aid, that purple burnout Kool-Aid, that the gaslighting Kool-Aid, would have us believe that we have a deficit or deficiency, or we have a resilience challenge. And whether that's intentional or not, it leads the nurse to feel disempowered, inferior, less than, disenfranchised, and a whole host of really unhealthy things. So the first thing is to know that this is what was shocking that was revealed out of my research, was that if you look at all of the symptoms, there's like something like, the exact number escapes me, but like 90% or more symptom overlap. And so the first thing we do is we assess across all the wellness domains and identify what of those symptoms they are. Because quite frankly, at the end of the day, your autonomic nervous system doesn't care if it's burnout or trauma, right? Or compassion fatigue. Your mitochondria don't care. They just need to be supported. Healing needs to happen. And so we look at the symptoms to see where and how each individual nurse is being affected, because, we all start with assessment. And then instead of just putting a bunch of self-care out there, and this is where I got a little bit frustrated, quite frankly, when I was looking at the ANA and other reputable places that are putting out resources. They're not trauma-informed resources. They're all purple Kool-Aid gaslighting resources. So if you are putting all of this self-care, because guess what? We all know, everybody in this call knows that nurses know how to take care of themselves. This is not a knowledge deficit.
Right.
But what it is that we're trying to do the traditional self-care practices, and we're putting them on top of a dysregulated nervous system and mitochondria that have been so depleted that they literally and physiologically cannot keep up with the energy demands. And so you're in a state of kind of this shutdown. And it feels like, am I being lazy? Is there something wrong with me? Why can't I go to my, do all of these things? And so we take a whole different approach. So I don't even use the term self-care in my work. You won't find it. You'll find it once in my book to say I don't use it. And, and I don't use the word resilience either. And so the first thing we do is we start to learn how to nurture and nourish our autonomic nervous system, our limbic system, and our vagus nerve, and understand how they work together. And we start assessing where we are in any given nervous system state, depending upon our internal and our external context, right? So all of us have experienced trauma, and that which did not get integrated is still stored in the body. So if the three of us right now, if we had gone through a very traumatic event at work together, right? And there's no lack of examples out there, so I'll let you draw from your own experience. Each of us might have a very different nervous system response to that same exact trauma. And that has what I call the repository. So each of us has our own repository of unintegrated trauma that's stored in our body, and it gets activated. I don't use the word trigger. It's such an aggressive word. I don't know who thought using the word triggered for trauma was a good idea, but
it makes you like, it's scary.
Yeah, and it's overused.
Yeah, and overused. And so we start with that, and then how to recognize where you are in your nervous system and what it needs for you. Because, if people try and meditate and they're like, I can't meditate. Well, of course you can't meditate. You're in sympathetic overdrive.
Yeah.
A fast walk, a jog, a hike, any movement, go dancing, any movement will help with that. But, it's like asking a firefighter to go sit inside a burning building and meditate.
That's just like a great analogy. Yeah.
It is. I love that.
So that's where we start. We start what I call it the foundation. Because putting self-care on top of a dysregulated nervous system, this is what really answered my research question, is why hasn't this changed in 50 years, for Pete's sakes? I've been a half a century.
It hasn't, and that's for sure.
Minds. Yeah, we got brilliant minds looking at it, and it's because we're still drinking that, and not by we, not the people who are on this call, but we as world leaders are still having that purple Kool-Aid that it's the nurse's fault. Well,
Can they take that Kool-Aid away from them?
Yeah, I mean, it's just
they passed out a lot. Like they each get a pitcher right when they started the purple Kool-Aid.
Yeah, well, had a little too much.
Pervasive.
Yeah, seriously. Nurses, if this episode is resonating with you and you are dealing with nurse burnout, nurse-specific traumatization, you definitely need to check out Dr. Lorre Law's 12-week program.
Yeah, she's taken 5 years of research, evidence-based practice, and developed a 12-week integrated program to help heal nurses. It includes one-on-one sessions and all sorts of resources.
I love that it's not just reading something online and that you are actually going to get to speak with the person, and she's got a whole team of people working with her. You guys should head to drlorrelaws.com/uncorked. That's drlorrelaws.com/uncorked. This next question I'm actually very interested in hearing you talk about. What are some of the most common signs of trauma that nurses overlook in themselves? Because I think that when this is first occurring and first happening, I don't know that nurses recognize it right away. Mm-hmm. So can you give us some examples of what you think happens?
Yeah, so physically, the most common things to look for is exhaustion. And it's so easy. And I'm not talking about the type of exhaustion that I've had a hard day and I'm tired after my long shift, right? We all know what that is. I'm talking the type of exhaustion where I can barely drag myself off the couch to do the things I love on my day off, right? Mm-hmm. That kind of level of exhaustion where it's like, I'm in a garden and I'm going to do all these wonderful things. And you end up with Netflix and, a food app to bring you some
food. That's what happens a lot for most nurses. Yeah.
So if that's you out there, please know that is a physiological response. It is not a character nor personality flaw. That is literally
part. That's very helpful, I think, for people to hear.
Yes. Yes. And then
it's like a coping mechanism. It's a way of like, you just can't, you've been so overstimulated that you just
well,
can't.
that's exactly what happens is that your midbrain, Porges calls it your threat detector, has signaled to the vagus nerve, like whoo, 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 too much, because we can do short bursts of stress. That's how we are hardwired. We can't do what we've been doing for, it's not sustainable, and we're seeing that. So you're looking for things like sleep disturbances. You're looking for GI disturbances are very common. You're also looking for kind of self-isolating and withdrawing. This was a big one for me when I was going through my personal recovery, is that I just couldn't take any external stimulus. I couldn't handle one more piece of information. I could not handle one more human interaction. And sadly, even with my loved ones, because I was that depleted. I was in that kind of what we call the freeze state, where your body is shutting you down to conserve energy because you don't have enough to do all the things you want to do. So the body's wisdom always does, it preserves vital resources and functions. And so you're looking for signs that you might be engaged in higher risk behaviors than you would be. You might be binge shopping, or, enjoying, that third or fourth glass of wine after dinner instead of, maybe the one or two that you might ordinarily have. So things.
Erica, why are you looking at me, Erica? I can see her already. She's honing in. I'm like, hey.
You caught that, did you?
Yes, I did. Yes. But no, you're right about.
Well, look, she was already describing me with the couch and the Uber Eats and the Netflix and the self-isolating, because I'm right there. Have been.
Right.
Yeah. Yeah.
And then really the other big thing is, and I see this, this is in new grads, but it's also in established nurses too, but we all walk through it at some point. And it's like questioning, why in the actual F did I think this was a good idea, this profession? You start questioning, and those are good questions. Keep leaning into those questions, because first of all, you'll discover that the system and healthcare organizations would have you believe that you have a deficit in some way, shape, or form, when in fact they are inflicting avoidable nurse-specific trauma on you.
Victim blaming.
And you were having, blame the victim. Like, where is that just culture exactly? Looking, and so, you might find that your relationships, are not as high. You might be having, more friction with your partner. You might find yourself amotivated, and again, these are not character deficits or personality flaws. What we don't get in nursing school is how to insulate our nervous system from all the trauma exposure that we are going to encounter in practice. And so what we're left with is what we're seeing now is largely a dysregulated, unhealthy workforce that is not safe. We aren't safe in our roles most of the time, which sends that whole polyvagal theory, that flight or flight, into action, right? And if we stay in that sympathetic for too long, then we go into that shutdown that we just talked about, the freeze, right? And so here we are. And so it's really, I can say this here. I just wonder if that's by design.
Because that's a whole other episode. Yeah.
Well, I went through the AACN Essentials, the American Association of Colleges of Nursing, because I'm an educator. It's my gig. And I was like, why isn't what I'm finding in this research, right? I mean, it's right there for the taking. Somebody just had to get pissed off enough to go, what the F? 50 years, you guys.
Listen, if they, and I'm sorry to cut you off, but
no, you're fine.
If they admitted this, if they were found to be the cause of it purposefully, let's look at the long term. you wouldn't have the quote unquote nursing shortage, right? Because nurses wouldn't be fleeing the bedside at breakneck speed. And if you don't have the quote unquote nursing shortage, well, then you don't have the most convenient excuse ever invented to get away with hiring and staffing less nurses, AKA improving their profit margin.
Yep.
Wow.
Yep. None of the self-care is trauma informed. Mm-hmm. And so now we have a whole global community of nurses that have lived through a pandemic, and independent of anyone's opinion on anything, I'm not here about that. I'm here about the impact that has had on each and every one of our nervous systems, in directly or indirectly, because it was a trauma for humanity, experienced differently by each and every one of us. Now, we were so eager, and understandably so, to get, quote, back to normal, which in our case, normal wasn't that great to get back to. Right. So right, that's when I was doing the research. That's when I was working with all the nurses. That now we have all the next generations of nurses coming out, and we see, in fact, I just spoke to it at a faculty meeting Thursday actually. And that what we're seeing is that, the nurses, the new grads are just not resilient and they just fall apart. No, they have unintegrated trauma. And then we put them in a traumatizing program to train them as a nurse. And then we put them out in a system that is inflicting avoidable trauma.
I just had a huge aha moment with this last 5 minutes of conversation, because I've never really thought about, maybe they think it's a great idea that nurses are leaving.
Jessica, I've been telling you this for years. You're not paying attention to me.
You didn't explain it the way Dr. Lorre did.
Oh my God.
I mean, because when I was at my wit's end and I was ready to just leave, I couldn't understand why my manager didn't care. I was like, how is it that
she's going to replace you with a new grad for a fraction of the cost?
Right.
Yeah, and that's what she said. But I never thought that they would really want that, and it's a possibility. It's a possibility that you never said that, Erica.
I have been saying the same stuff for years. Maybe not as eloquently.
Yeah, it's just phrased differently. Well, but it's maybe if they do have less numbers to work with, then it does financially work to their advantage.
Yeah.
So that literally at my head just went, wait a
minute. But until now, it's not working, because we're losing anywhere between 25 and 40% of our early career nurses. So this burn and churn, hire to fire model that has worked so well for them, right? Over the decades.
It's going too extreme now. It's getting
now the new grads are coming out and they're like, you want me to do what? No, I'm not doing that. Peace out.
You want me to be charge nurse? I've only been here for a week.
Exactly.
Right?
Yeah.
Mm-hmm. And so that approach isn't working. And so I've met with several nurse leaders in hospital settings. They're like, we don't know what to do. We've done all the self-care things. I'm like, well, because you're not getting a root cause. The root cause is that we have to, first of all, get these nurses to a place, virtual or physical, where they feel safe. Because most nurses do not feel safe. We are in fear of losing our license about 20 times a day.
Yeah.
Most people, and so that goes into the nervous system. That gets flagged as potential danger. And so now you're out of patient-centered care, and now you're on sympathetic overdrive, and then you go into the freeze, and the cycle perpetuates. And so this is a really big opportunity for what I call nursing 2.0, which is we are long overdue for a reboot. All of the paternalistic, subordinating, oppressive practices.
Misogynist.
We need cardiac paddles. We don't need a reboot. We need a complete electrical
cardio version.
Seriously. Yeah.
Well, and that's why if we start with understanding that nurses are being traumatized and why and how that is happening. Now the military's in the trauma business, if you will, right? Mm-hmm. They have it figured out, as does law enforcement, other professions that have very high trauma exposure, that they go on tours. They go out for X number of days, and then they get a chunk of time off to process and integrate all that has happened. But that is not the case with nurses. 83% of nurses report that they don't have any resources for the trauma exposure that they endure every day.
It's true. The military, even during active wartime, they get, what do they call it? TDY, right? Where they are literally sent to like a beach somewhere tropical for a week or two.
That sounds wonderful.
I know, but like they get it that you need that. You know?
Instead we're asked, and can you sign up?
Can
extra
you work
tomorrow?
overtime? Yeah.
Right. And I need you on this committee. And, we have these mandatory trainings. Oh, I'm sorry you worked all last night, but if you don't come in, we're going to write you up. So can you just come in without any sleep? And you guys have done such a brilliant, brilliant job bringing all of that awareness in. I'm so grateful for the good work you're doing, truly.
Thank you. Erica, Stink Bomb Odor Blocker has been sponsoring us for so long that I've gotten stories from nurses and have heard feedback on Stink Bomb, and some of the nurses have told me that they love the smell so much that they're not even using it for what it's intended for, which is to block something stinky. It's almost like rubbing lotion on or putting perfume on. Like they just love some of these scents so much that they will just dab it under their nose and smell it. But I could see that.
Yeah. I mean, especially in a hospital, like even when you're not dealing with horrific smells, it still does not smell the best in there.
There could be stale smells and all other sorts of stuff, but I could see how it could be addicting. I mean,
and some people have the little carriers. Show them yours.
Little batch holder. So it's right there and it's handy and it smells good. Check it out. Get it for some of your nurse besties for Nurses Week. Go to stinkbombodor.com and use code UNCORKED15 for 15% off all of your purchase.
You write about something that I have studied and been interested in for a very long time, that nurses don't intentionally eat their young, but rather it is a subconscious transfer of generational trauma, moral injury, and unhealed compassion fatigue. Can you talk about that a little bit for our listeners?
Yeah, well, it's so interesting. So before I was a nursing professor, I was over at the College of Social and Behavioral Sciences. And I think that's why I was able to find this evidence, because I wasn't working in discipline, and so I got exposed to a whole bunch of different ways of thinking and being and doing in all of this. And you start looking at how generational trauma, ancestral trauma works, which is something I was studying over in this other role that I had. And so what we know about that is that what doesn't get processed, what doesn't get fully integrated is the term, gets stored in the body. I think that's becoming more common knowledge. But what is not so much common knowledge is how that gets transmitted through the DNA to the next generation. Right. So, for example, the legacy of slavery is a very well studied example of this. That 3 generations, 10 generations down, there are still signs and evidence of this unintegrated trauma that had happened decades ago. And so when we start looking at nurse-specific trauma, and we look at historical trauma, which from out of the gate, nurses have been traumatized out of the gate. Whether if you were a nun, whatever, you were expected to work ridiculously long hours for very little pay, blah, blah, blah. But what has happened over the years in contemporary terms for nurses is that we get out into practice and we are in the similar way transmitting nurse unintegrated trauma, the legacy of the nurses and the generations of nurses who have gone before us. And it's not being transmitted through the DNA, but it's being transmitted in the work environment. And it's showing up in ways like gaslighting and hazing and bullying and workplace incivilities and all of the things you do such a good job bringing awareness to. And so this nurses eating their young, it really is it's ancestral trauma, nurse ancestral trauma that's being retransmitted unknowingly.
Yeah. I think that is fascinating stuff. I love all the kind of generational research when it comes to nursing.
Yeah. And there's something we can do about it, and so now that there's awareness, then there's opportunity for healing and for change.
Yes, absolutely.
That's a good thing. Yep.
Yeah.
Let me ask you something, Dr. Lorre, really quick, because I know that this is the one answer that nurses are going to want to hear.
Yes.
Okay, because I know you're very smart and you've researched a lot. Can they be happy again? Can you be happy? That's what I think nurses want to know. Because when you're at that point, can you come back and can you be happy like you were at some other point in is it possible?
It is possible, but it is not possible. Okay, I'm gonna give you a yes, but just to be fair, it's a yes, but.
Okay.
You can learn, but maybe let's not go with happy. Let's try content. Can I be content?
All right, that's fair.
Can I find meaning?
Good enough.
Yeah. Can I find meaning in my job again?
Okay.
Because what I don't want to do is I don't want to hate and dread every single moment that I either am thinking about going to work or being at work, because it's so overwhelming and it's so traumatizing, and I don't have the tools and the resources I need and to go look at a tree and everything will be fine, right?
Go plant a tree.
Right.
We won't get into that.
Go do a yoga class. You can reclaim your professional safety. You can insulate yourself from the dumpster fires that are happening all around you. You can learn how to navigate these archetypes, because you can stay regulated in your nervous system. They can start co-regulating off of yours without you doing anything. So you're staying in what is known as your window of tolerance. So that's the skill development. Then you can start reclaiming your personal and professional empowerment. And from that sense of being solid in your body and clear in your thinking, that it will be easier for you to say no to unreasonable requests. It will be easier for you to advocate for yourself when you need to advocate, or for your unit, or for your patient, because you're regulated in your nervous system. You can do these things. When we're dysregulated, that part of our brain goes offline partially. And from that place, that is where the contentment, that is where the happiness, that is where the joy and the love of your profession can come back. We have to get back in a place where we are in the driver's seat of our career. They need us more than we need them.
Yes. But what I like is your honesty, though. You're not sitting here saying you're going to be like Mary Poppins and be back at work singing. But hey, content would be good enough, I mean,
it's a start to happiness for sure. Right. And it's more sustainable, as it turns out. Contentment, happiness is a fleeting emotion, whereas contentment is one of those more kind of enduring emotions.
Okay, yeah,
and I would take that.
Yeah. What's one wellness hack that you'd recommend to any nurse that's listening right now?
A wellness hack is to take 30 seconds. I call it a microdoses matters break. You can do it in as little as one deep breath, right? One conscious breath. But it's really, what we need to do is we need to interrupt the signaling that comes from our environment that there isn't time for us. We can't use the restroom. We can't hydrate. We can't nourish ourselves. We can't, right? This is 30 seconds. Now your brain is going to tell you, I don't have 30 seconds. Okay, but here's the practice. Microdoses matter. Find a safe space. Dip into an empty patient room, the conference room, wherever you can, the supply room, wherever you can have 30 seconds to yourself. Even when you're sitting down to chart, kind of slow that down for 30 seconds. Nobody has to know what you're doing. Give yourself a little bear hug.
Okay. Just ignore them.
Just say,
I'm on my 30 seconds. I'm on my 30-second break. Please.
Right? I mean, how ridiculous that it has come to that we do not feel that we can take 30 flipping seconds.
That's the truth. The second you said at the nurse's station, I was like, I'm on my 30 seconds. Before I lose it, I'm on my 30 seconds. So in your book, you write that unlike police officers or prison guards, nurses are not trained to address workplace violence, nor should we be. Healthcare organizations are responsible for providing occupational safety, but fall short where nurse safety is concerned. You also describe some of the violence you have personally experienced as a nurse, including, and people have dealt with this, having excrement thrown at you, Do you get the sense that nurses are finally beginning to understand this is not part of the job? And do you feel that the perception about that has changed?
Well, yes and no. I've talked to nurses in Italy, over in Australia. I have talked to nurses in Finland, and it's the same story everywhere. It's worse here. It's worse in the States. And I think I think nurses are becoming aware that this isn't okay, but we are so disempowered as a profession because the system, and I'm just gonna lay it down as directly as I can, even if people aren't happy about what I have to say. The system is literally terrorizing nurses with the amount of trauma exposure that we are inflicted with, and whether intentional or not, because every place is different. So I want to hold space and acknowledge the places that are doing it well.
Dr. Lori's taking her 30 seconds right now.
Okay.
There are some good places. There's some good places.
Yeah,
we don't know where they are, but we're told.
We haven't found them yet, right? And so are we making awareness? Yes.
It's California.
Yes. But nurses are so disempowered in our professions, and it's because we've been told that the purple Kool-Aiding, it's our fault that we feel this way, and therefore we can't empower as a collective profession, and we cannot do that. We cannot do that until such time that we get to root cause. I'll let you answer the question. You've just had a patient assault you in any one of the numbers of ways that we all know. Right, and you go in, you follow policy, and you go up the chain of the command, and you sit down at your leader's desk. What's the first question that you're asked?
What could you have done differently?
Mm-hmm.
What could you? That's called system-induced trauma. That is
victim blaming.
Induced trauma. You try and advocate for yourself, and then 10 other things come in, and you get knocked over again, and then you're in that Netflix and Uber Eats mode. Understandably so. And so we're in this sort of vicious cycle. And that's what I'm hoping to do my part, as you guys are doing yours so beautifully, that we can all start coming together as a nursing community. And
do you think that the nursing schools are starting to teach that, though? Like, no, it's not okay for your patient to throw their stool at your head. Or are they beginning to do that? Because I know when I went to nursing school, I was taught it's part of the job. Right. Are we getting away from that in the learning process?
The essentials that we are given as nurse educators that we have to comply with. We have to meet all of these things, competencies and sub-competencies, Rama, that there is not, even at my own university, there is not room in the curriculum to bring in this information.
That's sad.
I hear that all the time from educators.
That's really frustrating.
Well, it pissed me off enough that I went to writing school and figured out how to write a book and get a publisher and get it into the living rooms of the nurses that need it the most. Because what else? How else are nurses going to learn? Because they're
how do you know how to protect yourself? How do you know?
You just don't.
Tell us about your Healer's Heart assessment and how it helps nurses identify their trauma points.
Almost every time people come through that assessment going, I didn't even know I was experiencing all of that until, because sometimes we just have to sit with it. All of us are in that overdrive place. And so first of all, is getting that assessment done, as with any nursing anything, assess. And then the second part of that is meeting with me one-on-one for a 30-minute, just for me to support you and see if and how, what you want to do with that information. What is the best fit for you? It really starts with assessment and then really coming back to that being seen, heard, honored, valued, felt, and supported. That's what that 30 minutes is about. It's just about you being able to express
validated
all that you have endured in a way that's, affirming.
Do you ever have people that just cry the whole 30 minutes? That would be me.
I do when nurses meet with me all the time.
On the 30-minute session, I'd be like...
Yeah, it's that, because
seriously.
You know what? Because what that really signals, and the answer is yes, what that really signals is that they feel safe. They feel safe.
You feel safe unloading.
For the first time, maybe ever. Because do we feel safe in nursing school? We do not.
No.
Do we feel safe in transition to practice? Said no nurse ever. Do we feel safe as early career nurses, no. And I, the more senior nurses, it gets to be a little bit mixed. Some of them really will tell me, I'm so dissociated, I don't even know how I feel anymore. I'm just trying to get through this.
Yeah, some people are numb.
And that's fair. And that's a trauma response. That is a hallmark trauma response, is that numbness and that kind of disconnection. And sadly, the disconnection also happens within us. That's the really sad part. So we get disconnected internally and then with the people who matter to us the most. And that's really, I think, one of the saddest things, because it affects so many relationships.
The constant push for nurses to practice self-care implies that it's within our control to navigate the systems that were created to fail us, let's be honest. What would you say to the critics that feel this unfairly places the work and burden of responsibility onto the nurses who are the victims of the toxic workplace and the corrupt employer?
Well, I mean, the first thing is awareness that you are being manipulated. You are a pawn on a corporate chessboard, and that you have agency. You have everything already within you to self-empower. Sometimes all of us need a little help. We need a little education if we don't have the tools that we need, right? That's called life. But we all have what it takes to get through this, but we have got to stop accepting the status quo.
Yep.
The status quo is designed to keep us imbalanced, off-centered, traumatized, and disempowered. And so first and foremost is reclaiming and I mean power, not coercive power. I mean power in the sense of empowerment, reclaiming that which has been stripped from our profession and taking it back.
And learning to say no. And that's a thing that has to be learned, because nurses are innately givers and guilt-ridden, and and learning to say no is okay.
No.
Yeah, it's okay.
It's a noble no. It's noble because you are taking care of yourself and you are setting your professional boundaries. Because guess what? And you guys speak to this so beautifully. Nobody's going to say, you know what, Erica, you have already worked 50 hours this week. Would you like a day off next week so that you can process and integrate everything that you have been through?
Process and integrate,
right?
Yeah.
I would be like, am I in the Twilight Zone?
Yeah.
Right.
Yeah.
But that's what we have to do for ourselves. And that's the noble no. It's like, I've already worked my 312s this week, or whatever your situation is.
Yeah, and it's okay to not do the extra. And that's the thing, is that you're guilt-ridden into, you're not going above and beyond. You're not doing more, Well, when you hired me, you didn't say I had to. Like, sometimes we just don't want to.
And what are they going to do, really, if you say the noble no? Is that, I don't even give explanations anymore. It's like, well, thank you for the opportunity.
Thank you for that offer, but I decline.
I'm unable
no is
to
a complete sentence.
Yeah, my schedule is fully committed. That's what I say a lot. That's my noble no. Now everybody knows that at work. But my noble no is my schedule is fully committed. Well, shoot, I worked 70 hours this week. That's an accurate statement.
Right.
And then this is the part that I think is hard for humans and nurses, especially, to Jessica's point, is that then at the end of that sentence where the period is.
Yeah, I say that all the time.
Because we feel the
Stop
need
talking.
to explain, like,
people are afraid
if we don't have
of the awkward silence.
Yeah.
Also, embrace the awkward silence. I love the awkward silence, and I'm just going to look at you. You will speak eventually.
Right. And let them sit in the discomfort that they created. It's not your discomfort. You're letting them sit in the milieu of that which they created.
I think it's wrong for managers to go up to somebody's face and put them on the spot like that.
Well, they do that on purpose. It's strategic.
I know, but it
to
shouldn't
catch them
be
off
that
guard.
way. I mean, if you want to send a mass email out or whatever, because I know that happens, or a text, okay. But when you look at somebody in the eyes and you're like, hey, what do you got going on tomorrow? I noticed you're off, and while the kids are at school, do you have a little bit of time you could come and help? Like, it's not fair. It's not fair to put somebody on the spot like that.
It's predatory.
Yeah.
Yeah, it's manipulation and it's predatory. Exactly. That's the perfect word. I wish I would have had it for my book because I would have used it, Erica.
So, Dr. Lorre, for somebody that's looking for that scholarship, okay, what is the keyword for the 12-week program?
Well, since you said scholarship, I think we should go with scholarship.
That's a great one. I love it.
The key word is scholarship.
Scholarship.
Perfect.
All right.
And it's the 10th listener who emails.
Yep.
Nurses Uncorked at nursesuncorked.com. Jessica, I hear that you have an Enema award this week to hand out.
I do. I have an Enema. It's brought to you by Happy Bum Co., a leader in at-home enema solutions.
Enema of the week.
So, Erica, in talking with Dr. Lorre today, Dr. Lorre mentioned 2 of like the first signs or symptoms of nurse burnout or trauma response. The first one that she said was exhaustion. And then immediately the second one made me think of Happy Bum Co. She mentioned GI issues as like one of the number 2 signs of a nurse feeling, because it makes sense. It's your nervous system. It's all connected.
Yeah, well, nurses are one of the top occupations that suffer from gut issues between shift work, high stress environments, and no time to go to the bathroom. It's no wonder that nurses end up with constipation, bloating, IBS. And so one of the ways that you can treat some of that easily at home is with Happy Bum Co., a leader in at-home enema solutions. Tell them where they can get it.
You can go to happybumco.com and make sure to use code word Nurses Uncorked and save yourself an additional 15% off your first bundle purchase. This podcast this week really brought this to the forefront of my mind, some traumatic memories. Speaking of trauma, in nursing school, I had a clinical instructor. Her name was Dr. Becky. Okay. And she literally scared the living shit out of me and all the other nursing students. She wasn't very nice. She was intimidating and not friendly in clinicals, was not approachable, would make you feel stupid, demeaned you, and just was one of the scariest instructors that we had. To the point, and I'll wrap this up, but to the point that I had crushed up some meds for an NG tube and mixed them all together and was ready to give them, and I had forgotten to take the patient's blood pressure. So I had remixed them all up, and you were supposed to hold the med if it was...
Yeah. The parameters, yeah.
I'm going to hell. She was slightly under the parameter, but I was so scared of Dr. Becky. I was so scared. It was like, it was off by like, I think it was under 100 over 50, and I think she was like 98 over, and I was so scared of Dr. Becky. But you see how that intimidation and that fear would, because I was like, oh my God, if I have to tell her I crushed all these meds up and messed up all of her medication, I didn't. I flubbed the charting. I was already a false charter. So Dr. Becky, if you're still out there, this one's for you. You also sent me to the ER with severe palpitations, but that's a whole nother story. I thought I was having a heart attack. Anywho, we'll get into an anxiety episode on another Nurses Uncorked, but this enema's for you, Dr. Becky.
Enjoy. All right. What book would you recommend to our listeners about healing from trauma, or where can people find your book, connect with you, learn more about the Halen Institute, all the good stuff?
Well, my website is drlorrelaws.com, and everything is on there. If you want a book to help you that's conversational, like we've just been hanging out here, with complete bias, I would recommend my own book, which is Nursing Our Healer's Heart.
Yep,
right? Because it's like you're sitting in private session with me. And through case stories and the assessments, some of the assessments are in there. Yeah. And then I walk through the whole arc that we've talked about today, as though you were in private session with me. There's other, Dr. Karen Foley, who's Middle Range Theory, for those people who prefer an academic read, that's less conversational and more kind of academic. She also has a book out. It is her middle range theory that my work is grounded in, and that's also available. Her last name is spelled Foli, Dr. Karen Foley, and the name of her book escapes me at the moment. Probably because I love my own book so much.
And for those that aren't watching, Lorre is spelled Lorre, not Lori. So if you hear her say LorreLaws.com, it's Lorre.
And anywhere else that people can connect with you? Are you on social media or anywhere else?
But I'm at Dr. Lorre Laws on all outlets, and we will soon be doing some live streaming on YouTube, which I think is the platform that best suits my work, because you can't, as we've discovered today, it's really hard to unpack some of these things in a 1 minute reel. Some of these things just requires time. So I have some content up there already, and there's some homegrown podcasts that me talking to the camera, and there's a lot of, you can see me guest appearing. I put the guest appearances on my website also. So there's a lot of free information out there on my outlets, and the best way is just to visit the website and see what resonates with you. Yeah, see what feels aligned for you.
I just looked up the title of Dr. Karen Foley's book for those that are interested. I believe the one you're referring to is The Influence of Psychological Trauma in Nursing. There you go.
Perfect.
Thank you for that. I should probably have that at the tip of my tongue. I've cited it so many times. It's just become, 23 on my reference list or something.
Thank you so much, Dr. Lorre, for imparting your wisdom today to the nursing community and to our listeners. And thank you for having the courage to tell the real story, because not too many people in nursing, academia, and leadership do, unfortunately.
Yeah. Well, I'm retiring from academia this year, and I'm pursuing the Halen Academy and the Healer's Heart Academy full time. And I'm just really excited about it, because I feel like it's time that we really, as a global nursing profession, we come together, and somebody's got to be out there saying, we're here full time for you. And that person is officially me. By the end of this year, I'll be retired from academia and full-time service to our tribe. So that feels really good.
Well, you can tell how genuine you are and how much you care about it. It resonates. It comes across. So I think anybody that is needing a book or needing to look into
your program,
being healed, because most of us do. You can put your trust in Dr. Lorre. So thank you again. And until next time on the next Nurses Uncorked.